UPMC leadership telling us they're prepared for any increase of hospitalization when it comes to COVID-19. Samir Nefsi joins us now in the control room with more on why health experts believe they're ahead of the curve when it comes to these spikes. Samir.
Sean, good evening to you. Yeah, as we know, COVID-19 numbers continue to rise, but doctors are saying that it seems the virus itself is less deadly than what it was back in the spring. That is why doctors are now urging Pennsylvanians to do their part to help the mitigation efforts. The bad news, the number of coronavirus cases are at an all-time high. The good news, many are less severe than what we saw in the spring.
They're not resulting in high numbers of patients requiring breathing machines, intensive care, or dying.
Over the pandemic, doctors have learned a lot about the virus, how to spot it, treat it, and mitigate the spread.
In fact, our mortality rates, our ICU admissions, and ventilation rates have dropped by 50% since the spring.
According to doctors, the use of ventilators for hospitalized COVID-19 patients have dropped from the 30% in the spring to 14% currently. Out of the UPMC network, less than 7% of patients are hospitalized for the virus.
And should the need arise, we can add and share resources, transfer patients, and mobilize staff between facilities.
With the vaccine projected to be out by the end of this year, doctors say it will not be readily available due to a limited supply.
We will clearly follow whatever governmental guidance comes down on distribution and delivery of the vaccine.
With Thanksgiving getting closer, the hospital network anticipates another spike in hospitalizations connected to the holiday.
We are asking everybody to change their behavior over the holiday season. It is important that all of us modify how we celebrate now so that we can be together with our extended families in the future.
Those doctors emphasizing if you do not feel well to stay at home. In addition, they also talked about mask wearing, saying not to remove your mask for things like talking or when you need to sneeze. Sean?
All right, Samir Nefsi in the control room. Thank you, Samir.